the biggest challenge to us, and the most important thing for a person which is needed, that is called health. Out of the health, there are certain things which are even more important and more common. One of those more common diseases or the health issues are health heart problem. Heart problem is becoming more and more common with the passage of time. So for all that reason, I think we should be more aware about that. And there are common incidents of heart attack. Heart attack is becoming more and more common, which is not a good sign at all. And I think for that reason, it is very much important that we should remain well aware about the health issues, particularly the heart problem. Today, we are going to talk about if at all a person experiences heart attack when somebody is alone. Somebody is alone and she has suffered a heart attack, then what should be done? So first of all, before going toward what should be done, we need to understand whether indeed it is a heart problem, whether indeed it is a heart attack. So there are five signs, five symptoms that whatever I'm undergoing at the moment, it is nothing but the heart attack. Number one, it is that there will be a chest pain or a discomfort in the chest area. So that is the sign number one, that a person that I am at the moment suffering from the heart attack. Now the second sign that a person is suffering from the heart attack, the person is experiencing the heart attack. The second sign is that there will be shortness of breath. There will be shortness of breath and the shallow breathing, not a normal breathing at all. It is not easy now. It has become difficult for me to normally breathe. So that is the second sign of heart attack. The first sign is that there is a pain in the chest and there is a discomfort, uneasy feeling in my chest. The second sign is that I am unable to breathe normally. So that is the second sign that I am experiencing the heart attack at the moment. The third sign of the heart attack, it is the pain and discomfort in the other areas, like areas near my chest, which could be the shoulders, which could be my arms, the left arm in particular, and even the right arm. So that is the third sign that a person is experiencing at the moment. And the fourth sign is that a person will feel dizziness and lightheadedness. That is the fourth sign that a person is feeling, that the person is experiencing the heart attack. The fifth sign is that a person is cold sweating. Cold, that is the fifth sign. The five signs that a person is experiencing the heart attack, let me repeat very quickly. The sign number one is that there will be the pain or the discomfort in the chest. So that is the first sign. The pain and the discomfort in the chest is the first sign that a person is experiencing the heart attack. The second sign is that there will be difficulty in breathing normally, and there short breaths. So that is the second sign that a person is experiencing the heart attack at the moment. The third sign will be that there will be the pain and the discomfort in the areas which are near my chest, like my left arm and shoulder in particular, the left arm and shoulder in particular, and then even the right arm. So it is the area which is near to my heart. The heart is located obviously on the left side of the chest. So the nearby areas of my chest, the nearby area of the heart, there will be also either pain or the discomfort in this area. The fourth sign will be that there will be lightheadedness or there will be the dizziness, and a person is feeling difficulty in maintaining the balance. So that is, although a person is sitting still, the person is sitting still, not moving, not running, not climbing the stairs. Despite all that, the person is feeling the lightheadedness or the dizziness. So that is the fourth sign. And the fifth and the last sign of the heart attack is the cold sweating. So that is the fifth and the last sign. So these are the five signs. But what to do once a person has confirmed that it is a heart attack? Now what to do? I am alone, somebody alone, but what to do in a situation like this one? So there are five things to be done. The first thing is that call the emergency. Here in Pakistan it is 1122, and there in United States of America it is 911. So call the emergency if at all. That is the first thing out of the five. I am alone, you are alone, and I have experienced the heart attack. The first thing is to call the emergency. The second thing is that there must be aspirin. Here in Pakistan, it is called Disprin. Always have Disprin, aspirin in the pocket at your residence, on your bedside, or at your workplace, wherever you are. There must be aspirin. Take out a tablet out of the wrapping and swallow it, chew it, swallow it. So that is the second thing to be done once a person feel that she is experiencing the heart attack. The third thing is stay calm. Do not unnecessarily, move your body at all. So staying calm, that is very, very important. The third thing to be done, if a person feel that, if a person is of the view that they are experiencing a heart attack, the fourth thing to be done is that whatever tight clothing, these tight clothing should be removed. And the fifth and the last thing to be done is that stay on the phone and stay connected with the emergency service. Keep doing whatever they are instructing. Here in Pakistan it is the 1122, and or if at all you can call a doctor. First of all, it is the emergency service, and comply whatever instructions you are getting from the emergency. And you told them, I feel like I have experienced the heart attack. Now these are the five things, the five symptoms which mean that a person has experienced the heart attack. Let me repeat all those five symptoms very quickly. The symptom number one is that a person is feeling the pain in the chest or the discomfort in the chest. So that is the first sign. And the second sign is that a person is unable to breathe normally. That is the second sign. We are feeling difficulty in breathing. So that is the second sign of the heart attack. The third sign of the heart attack is that there is a pain and discomfort in the nearby area. Heart is located on the left side of the chest. So even the pain and the discomfort in the left shoulder or the left arm, it also means that the person is experiencing the heart attack. And the fourth is lightheadedness. Despite that I am sitting still, and even then I am feeling dizzy, I am feeling lightheaded, and I feel like I will fall. So I will fall. So that is the fourth. And the fifth and the last sign is the cold sweat. That is the fifth and the last sign. What to do? The one thing to do, call the emergency. The second thing is to chew and swallow the Disprin, or I call it aspirin. The third is stay calm. Do not unnecessarily move your body at all. The fourth is that loosen the tight clothing. So loosen the tight clothing. The fifth and the last thing to done, it is stay on the phone and keep getting the instructions. Now how can we prevent, how the heart attack can be prevented? That is there are three ways to prevent the heart attack. Number one, know the risk factor. Knowing the risk factor, if at all somebody have a hypertension, high blood pressure, that is the sign number one. And then if at all the cholesterol level remains high, the LDL level remains high, the triglyceride levels high, so it means that a person might experience the heart attack. So that is the risk factor number one. And even it include that if at all there were certain family members and early, so the biggest there is the family, and family, if at all there is a family history of heart attack, and if there is a high blood pressure, or if at all there is a high cholesterol level, so that is the risk factor number one. These are all the risk factors. So that is the first thing to be done, that being aware of the risk factors. And the second thing, it is maintaining the healthy lifestyle, like balanced diet. Do not overeat the red meat. It is considered good or very power generating, but as a matter of fact, the lesser red meat you eat, the better it is. White meat is okay, vegetables are very much okay, lentils, pulses are very much okay, and the fruits are very much okay, and the nuts are very much okay. So that is, this it means that we are eating the balanced diet on the one hand, and we are going the regular exercise, any form of it. Could it be a walking on a regular basis? Now the third thing and the last thing, it is the medication. If at all the doctor has prescribed you certain medication, adhere to it. And will you like to know whether I should repeat the symptoms that a person is feeling, the heart attack? So that is a very important useful discussion about, if at all a person is alone and has suffered the heart attack, what should be done in a situation like this one. So there are 5 signs that a person is experiencing the heart attack at the moment. So the 5 signs are: the first one is the chest pain or the discomfort in the chest. The second sign is that a person is unable to breathe normally. There is shallow breathing. So that is the second sign that a person is experiencing the heart attack. The third sign, it is the pain or the discomfort not only in the chest but in the adjoining areas, like the left shoulder, like the left arm. The fourth sign is that it is lightheadedness or dizziness. Despite that I'm sitting still I feel like I will fall. I'm unable to maintain the balance. The fifth and the last, it is the cold sweating. So these are the 5 signs that a person is feeling the person is experiencing the heart attack. 5 things to be done: call the emergency, and chew and swallow the aspirin or Disprin. The third is stay calm, do not panic at all. The fourth is loosen the tight garments. The fifth and the last is stay on the phone. So these are the 5 ways to tackle it. And then obviously how to prevent it. First of all, know the risk factor. If there is a high blood pressure, there is a high chance of heart attack. If at all a person have high cholesterol level, it have another high chances. And the third is medication. Whatever medication is prescribed by the doctor, be very careful about taking it. Thank you.